New physicians are leaving medical school with two things: a license to practice and a lot of debt, making the idea of working in a higher paid, more flexible urban facility a bit more appealing. But our Brian Bendeley found one program that's providing students with the funds to go to school in return for a commitment to work in rural communities. Here's the story.
Scott Glover studies medicine at Oklahoma State University's Center for Health Sciences in Tulsa and says big city life isn't for him.
I went to medical school. I always wanted to go back to a smaller town. I knew that playing to my strengths that I didn't want to be in Tulsa. I didn't want to be in Oklahoma City. Nothing against those communities. I just liked being in a small town. I grew up with cattle and horses, and I wanted to go back to that type of environment.
Now a fourth-year student, Glover says the Physician Manpower Training Rural Healthcare Scholarship has helped him get through medical school.
It's really a good deal. If you're wanting to stay in rural Oklahoma, it's a very good deal because they go ahead and they give you enough money to make, so instead of starving through medical school, you can take the Physician Manpower and have a little more money.
Can you take a deep breath for me?
The scholarship is actually a loan forgiveness program. Recipients are awarded with a $60,000 loan and must be Oklahoma residents enrolled in a medical college and have a goal of working in a rural community.
You know, Oklahoma says they want to keep their best and brightest. Well, you're investing in your best and brightest to keep them in the state before they even start to look to go out of state.
The program requires students to work in a rural community for 2 to 4 years as payment for the loan scholarship, something Dr. Michael Iman of Manford, Oklahoma, says he not only participated in, but also encourages for doctors who are starting out.
You can succeed in rural Oklahoma and maybe have a better opportunity too, because you're not always the just the member, another guppy in the aquarium.
Iman has practiced medicine for over 20 years in Manford and also teaches medical students as they are required to make rounds in rural communities for 1 month.
During that month, we expose the student, not only allow the student to participate as a member of the staff of our clinic, but also a member of the community. And by doing that, a lot of students get their first taste and get a good taste of what it's like to be a physician in rural Oklahoma.
Exposed to not only how to practice medicine, but also a way of life.
I truly philosophically feel like the students that we are getting now are doing it because they want to give back to society, to mankind, something.
We'll have you lay your head back here and swing your feet up there.
I really liked the sense of accomplishment you have, and sometimes it is nice to go through and to know you really made a difference in somebody's life today.
A much-needed motto for young doctors to have as they fill a much-needed occupation in rural Oklahoma.